uptick in COVID-19 cases next month. Okta research fellow Guido David said that this uptick could happen if the Omicron subvariant XBB.1.5 reaches the Philippines or if a new variant emerges from China.
The nationwide COVID-19 positivity rate, or the percentage of people who were found positive among those tested, has declined over the past few days.
We're seeing a continuous decrease in positivity rate in Metro Manila. We won't really see the scale of the infection, and that's what we were even saying in the past 6 months. We're not seeing the full scale of the waves that we saw. Yeah, they're not as bad as before, as with January last year, but the numbers are still underreported.
Now, lest we forget, after a long holiday season, how's the COVID situation? The Okta Research Group is seeing an uptick in cases next month. Is this cause for alarm? We discuss in this episode of The Chiefs. Welcome to The Chiefs. Ako po si Robbie Alampay. Kasama po natin sa studio dito sa Mandaluyong, Ed Lingao of One News. Online kasama natin from Manila, Ami Pamintuan, Editor-in-Chief po ng Philippine Star. And in Quezon City, Lucy Cruz Valdez, Head of News 5. Chiefs, happy Tuesday.
Happy Tuesday, everyone.
Ami, sa mga balita, si resigned DND Chief Jose Faustino says, I cannot allow AFP's reputation to be tarnished, maligned, politicized. Anong ibig sabihin niya?
Well, inadmit na niya na he resigned na over the designation of, the sudden designation of Centino as the new AFP chief, na hindi man lang daw siya sinabihan. Pareho pala sila ni Clarita Carlos na out of the loop, ano?
Pero may statement ang Malacanang saying na alam daw niya na i-appoint. So you don't know who to
But in any case, between two different statements, it only suggests na merong gulo. Certainly some confusion. Hindi,
Kaibahan lang kay Faustino, nakakapagsuklay siya. si Secretary Carlos.
Nagsunuran na yung 7 to 9
Talaga, Ed.
DND officials, no? Nag-submit na rin. At
7, oo.
medyo malabo rin kung courtesy resignation yun o irrevocable resignation.
Pero hindi
Well,
na.
again, sabi nung spokesman ng BNP, si Mr. Andolong, ano daw yun? Courtesy daw yun. I mean,
Because they're co-courtesy. They're not civil service ombudsman eh.
So, yeah, we don't know what to make of all of this, no? We're even making news out of something that's really supposedly procedural. Ano ba, tayo bang OA dyan?
Pero yan yung laman actually ng rumors, di ba?
Exactly. Yes.
Na magre-rest na, yun na nga, hindi nagkakatotoo nga yung rumor. So,
Hindi, tsaka yung statement ni General Faustino versus Malacanang, doon pa lang, medyo magtataka ka na, di ba? Parang, ba't magkaiba? Sabi nung isa, hindi niya alam. Sabi nung isa, alam daw niya. Parang gano'n.
And also kasi the other aspect to this is the revolving door policy or syndrome, whatever you want to call it. I suppose a lot of people it's already normal, pero the thing is kasi it's been normalized over the years eh. Talagang
Yes.
sunod-sunod ang palit eh. In the last 3 administrations.
Oo naman.
Sunod-sunod talaga ang palit. I was doing a count kanina eh. Nung panahon ni GMA in her 9 years in office, she had 11 chiefs of staff. 10 of whom did not even stay for 1 whole year.
But 10 of whom retired before start.
Ang lalaki ng pension
Maganda
niya.
Ng retirement benefits. Yes.
Ito pa kay...
Malaki pa
Yes.
nila sa presidente ng Pilipinas.
Ito pa kay
Di ba? Oo nga eh.
Kay Pangulong Duterte, of course, stayed for 6 years. He had 11 chiefs of staff. So, on the average, almost 1 chief of staff every half a year or 6 months.
In the meantime, on the other side of...
Sana inagahan niya yung paglabas dun sa 3-year extension. No? Kasi lumabas lang yan nung patapos na yung term niya.
On the other side of this, in-explain ka kahapon ni Manny Bugato 'di ba, na yung kung susundin mo ngayon yung 11709, which really hopes to end this revolving door policy, ang isang implication naman noon is you have 3 batches of up-and-coming officers who may not get a representative eventually to the highest post. So
Yes.
ultimately, we do have to keep talking about 11709, the objectives there to fix this revolving door culture.
but
diba? But it might be the system, it might be the people essentially revolting or rejecting the reform, having difficulties.
But
in the
11-7
support.
Pero
11-709
11709, meron yung qualifier,
Oo.
Actually, ninegate yung yung sense ng...
Ay, nga,
Oo.
11-709.
May katsol.
Unless otherwise
May
terminated.
say, yes, may say pa rin ang presidente.
Yeah.
Kung gusto nyo, di ba?
11-709,
Diba?
11-709
Oo.
prevents overstaying generals, which was the problem nung panahon ni Marcos, kaya ang daming umalma at in part nabuo yung RAM. Because Espino stayed for 9 years, 9.5 years as Chief of Staff, Vera stayed for 3.5 years as Chief of Staff. So ang daming nabara dun sa promotion list. Yun ang problema nung panahon ng martial law. And that would have been addressed by 11-709. Pero sabi nga ni Ami at ni Lucci, you have a proviso that says that the president can shorten the 3-year term. So you go back to square one.
we're back to the revolving door policy. Diba? Anyway, obviously, marami pang pag-uusapan to. Hindi pa tapos yung usapan na yan. But we will go on to our topic today. Let's revisit COVID. Let's not forget, we are still in this pandemic. We speak to our first guest after a short break. The Chiefs will be right back. The national COVID-19 positivity rate was down to 5.7% over the weekend. That means the spread of infection is almost controlled, at least based on the World Health Organization's benchmark of 5%. But will these numbers stand? Joining us on the show is Okta Research Fellow Guido David. Professor David, welcome back to the Chiefs.
Happy New Year!
Hi, sir.
Happy New Year.
Happy New Year, Lucci, Ami, and Robbie. And kumusta naman? I hope you had happy holidays.
Yun na nga, Prof. Nagparty na kaming lahat eh. Yung iba, nagbiyahe na. We all had a good time.
Iba nga uli ni Robbie, oh.
Iba nga nagkakaroon ka pa eh.
Kailangan pa bang pag-usapan ng COVID?
Well, kaya may gusto pag-usapan siya.
Hindi, but let's start with this. Let's start with this.
Something that we need to be talking about right now. That we need to know.
Tuloy-tuloy na ba ito?
Should we be on this?
Tuloy-tuloy na ba siya?
Prof, let's start with this. Kanina sinabi nga natin, 5.7% positivity, and we asked, will these numbers stand? Let's start with something more basic. Are these numbers reliable?
Well, the positivity rate is reliable kasi it's like a survey. So it's a percentage. So it's like you don't have to test everyone. You can just do a sampling testing. In the way a survey works now, you don't ask the whole population the question. You just ask a sampling of the question. So yung positivity rate is reliable. The last time we had this low positivity rate, around May or June, so before the start of a series of waves of COVID. Sunod-sunod yun eh. I mean, We had about 3 over the latter half of 2022, but it didn't really make a lot of dent, even some news, because according to our survey, 9%, only 9% of the public still consider COVID a concern or an urgent concern. So 91% says na they have moved on. Pero moved on doesn't mean they have forgotten, kasi mataas pa rin yung mask compliance, even though it's optional. So that's a good news. Now, I think even by myself, when I go out, I think about 70-80% of people still wear face masks.
Pero sir, yung 5.7%, I suppose that's already pre-filtered. Kasi that only takes into account yung mga nag-RT-PCR testing. Hindi kasama din nag-antigen. And
Yes.
I think typically right now, yung mga nag-PCR testing lang are those who probably turned positive sa antigen testing. So you've already had 2 layers na pinagdaanan. Yung mga nag-negative sa antigen test, which we know of course is not as reliable, probably didn't take the RT-PCR test anymore.
That's true. That's why we have a model now that estimates the true number of infections. So, kunyari, bibigyan ako ng example. In Metro Manila, we're averaging, just around 155 cases per day. Pero we estimate that we're still getting around 6,000 infections per day.
Oh, new infections.
So, yeah, sa Metro Manila pa lang to. So, 6,000. I mean, of course, that's not really a big number. And when I talk about this, a lot of experts say, well, we look at the hospitalization. And that's true also. The hospitalizations don't increase. Because if we have a really bad wave, then we will feel that's a hospitalizations. We'll feel, if there are a lot of severe cases. So, there are less severe cases now than in the past. So that's another good news. Of course, doesn't mean that we have 0 severe cases. We just have less, and probably much less. It doesn't fill up the hospitals, but we still get a few deaths. I mean, right now we're averaging maybe 10 deaths per day, mga 10 to 20 deaths per day. So unfortunate, and we can't neglect that. Pero considering where we were from, this is relatively much better.
China notwithstanding, we all know what's happening to China. Tapos yung variant doon, di ba? May inabangan nga tayo na hindi dapat mapasok dito. Parang in the context of that, Prof, what should we be looking out for?
Definitely, China's a concern. We're watching closely what happens with China. Some of us even recommended to increase yung monitoring sa travelers from China, maybe requiring a test, but it was not required. Officially, they have 0 cases per day, but from the news reports, and I have a friend who lives in China. He has a wife who lives in China, and they told me that they are getting a lot of cases, and I think yung mga naririnig ko is around in the order of 20 million cases per day. 20 million per day. So I think more than a third of the population has gotten infected. And there are some anecdotes, and my friend confirms it, naubusan na, sold out ng body bags. So what we experienced in 2021, hospitals are full, and a lot of deaths, there was some, at one point we had mass graves. They're seeing it now in China because they suddenly opened their doors to the public. They were under a 0 COVID policy over the past 2+ years, and then they decided, okay, we can't have this anymore. Pero it opened the floodgates. So far, the variants now na monitor natin from China are all similar to the ones we had here, mga BQ, XBB, BA5. So maraming names, but they're all very similar. They're all mga Omicron subvariants. They are very infectious, but they don't cause a lot of severity. They're mostly upper respiratory. Of course, what we're concerned about is what we don't know. So I think that's why we're a bit cautious. And we don't know if there's going to be a new variant. Na-mentioned pa nga Lucci, they're monitoring. There's this report na there are white lung cases in China. It's if it's white lung, it means na it's lower respiratory, so causing severe pneumonia to some people. So that's something that we are definitely concerned with.
Prof, last year,
Ano problema
especially in the final quarter, we were very, very conscious of waning immunity. We were also very conscious that on the other side of that, still not the ideal take-up on booster shots and so on. And parang we were trying to mark, ano ba yung countdown dito? When do we start counting and when does it bite? Is there a particular time or month that we're looking at in this year where we would be keen to see any effects of waning immunity?
Well, if you mean, Robin, when do we expect another wave? Because I hesitate to call it another surge because what we will expect will be like what we saw in the latter half of last year. Now we have increases in positivity rate, but the cases never increased above, I think it never even increased above 4,000 per day. But that's also a function of not testing a lot. If we were testing a lot, we probably would be seeing something like at least 50,000 cases per day at that peak. So when would we see that? I think even as early as February, we might see another wave. We're monitoring another new variant, yung XBB 1.5. It's spreading in the US, yes. And it's very transmissible, but again, not so different from the ones we had before, even XBB. It's not causing a lot of severity. We will expect more waves over the coming year, but nothing severe and nothing that will fill up hospitals. So, kumbaga, what we saw in the last 6 months of last year, more or less, this will be status quo over the coming year. So we don't expect cases will go down to 0 or remain at around 100 per day. We expect it to parang roller coaster. There will be small ups and downs and ups and downs. There could be mga 3-4 waves in this year. So we will see. I hope. Well, if that's the case, I mean that's more or less what endemicity is. I'm not saying it's endemic, but kasi we need experts to declare that. Pero just like the flu, you have flu seasons. It will be up and down. You'll have seasons wherein you have more flu cases, seasons you have less flu cases. In terms of deaths, we were looking at it. I wrote a paper saying that the number of deaths we have for COVID is more or less similar to the number of deaths we have for flu. So in terms of deaths, it's about, you could say it's almost like endemic. But then COVID is not flu. Let's all remember that. And when we talk about waning immunity, Robbie, yes, waning immunity is real. Because if you ask people if they, when they get reinfected again or when they get infected, it's usually at least mga, maybe more than 3 months after they got their booster or when they got their, when they got infected. So, I mean, natural immunity works and boosters works, pero the protection doesn't last long. I mean, if you got COVID, you'll probably won't get COVID over the next 3 months or even up to 6 months, pero after that you're susceptible again. So it's something na paulit-ulit, you could get it repeatedly. Unfortunately, mababa ng uptake rin natin. The state of calamity has expired. So from what I heard, they're just going to use the remaining stockpile of vaccines that we have. They're still under EUA, but as for the rest of, if we acquire new vaccines, it won't be under EUA anymore. So people will probably have to pay for it, or unless the local governments buy them for some of the A1, A2 categories, which I think they plan to do.
Professor, there were warnings before the holidays na baka daw magkaroon ng surge after the Christmas season. Pero ngayon, we're into 2 weeks na, wala pa eh. So, do we have anything to worry about? Ang next worry nila ngayon mag-Chinese New Year, and we're expecting a lot of travelers coming from China. Do we need to worry?
Well, yeah, we won't worry in terms of worry about a surge. So we're, I think yung seeing surges is a thing of the past, honestly, unless we get a new variant. So, of course, sa mga nakikinig, nanonood, this seems like a good news na we won't have surges like what we had in January of 2022, because all the variants are the same. They're infectious, ganon, immune evasive, pero not lethal. So we're not really worried about the surge, Ami. And we kakatapos actually lang ng wave natin nung mid-December. We had a wave. I'm not sure what variant it was. I thought it was BQ. It could be 2.3.20. Are we expecting one? Yes, like I said, we'll be expecting one. Maybe it will come February or March with the new variant, maybe XBB 1.5 or something else. Pero yun nga, with the holidays, wala tayong nakitang surge, if that's the question. Yes.
Yeah.
How does this situation impact on on the government's booster drive, no? Kasi, we're looking forward pa nga to this bivalent, di ba? Na kukuha tayo noon, and we're hoping that, we will increase the boosted population from 21 million now to, much, much more, obviously. Pero at the rate we're going nga, parang people are saying, nagpasko na nga, nagnasareno na nga. Di ba? At mag-Chinese New Year, parang wala naman nangyayari. How do you think this will affect them?
Well, yung Filipinos are, they're aware of what's going on, Luchi, more than maybe we give them credit for. And they're aware na, the masks help. That's why mataas pa yung masking. But they're also aware na they can still get reinfected even if they get boosters. Of course, the contention is about the protection for severity, and that's what we're promoting. If you get vaccinated, you're protected against severe. The booster uptake is really very slow. I don't expect it to take up even with the bivalent. My guess is most people who will get the bivalent are those who already got the first booster or even the second booster shot. So my guess is, just that 21 million or maybe even less. They're estimating even less of that. Maybe some people will get the bivalent, those who haven't gotten the boosters. Maybe we can expect some number there, but I don't think it will be that much higher than the 21 million.
Do you have any new surveys related to attitudes toward dito sa COVID or masking or booster shots, vaccination?
Well, we do have a survey. We had a recent survey in October, and we did ask yung urgent national personal concerns. We asked different questions, yung performance ratings. We also asked about self-rated poverty. In our self-rated poverty, 13% of respondents said they considered themselves not poor. 41% said they considered themselves poor, and 46% were not sure if they were poor or not. I mean, I think if you're not sure, for me, that's not a good sign. I mean, if you think about it, only 13% are confident that they're not poor. It's much higher in NCR. 20% consider themselves not poor. And we ask a few other questions. COVID is not a big concern anymore for the public, but they could still consider public health and jobs and prices of goods to be basic, to be fundamental concerns.
Prof, could you qualify what you meant when you said kanina that we can expect another wave by February? Just to qualify that and put that into context, kasi kung hindi, i-headline namin yan. What exactly do you mean by another wave?
Yeah, a wave would be, not like a surge. I mean, like what we saw in the past 6 months. The positivity rate increase, cases may go up to maybe 1,000 or maybe. I mean, this is not a prediction that it will happen. I'm just saying there's a possibility that it could happen, and it's not something alarming. My guess is if we get the XBB 1.5, that will cause infections and it cause cases to go up, but not to scary levels. So like I said, we could see 1,000. I mean, even the DOH is projecting, I think, 700 cases per day or something like that. But I mean, 700 cases per day doesn't sound scary at all, considering what we went through. But then again, we're not testing a lot. So itong mga waves that we don't really have a great visibility of it. Sabi nga ni Robbie kanina, testing, it's already pre-filtered. A lot of people are going with just antigen testing. Some people are not even testing because they're experiencing mild symptoms or asymptomatic. So we're not seeing a lot of visibility anymore. We hope there's going to be a policy change, especially kung masulong na itong CDC natin, our Center for Disease Control and Surveillance. Like Japan counts antigen test results, so they're seeing still good visibility, and they also have good biosurveillance. In fact, usually nalalaman natin beforehand yung mga subvariants natin by looking at when they test in Japan. Kasi in Japan, when you're traveling from the Philippines and you enter, I mean, not just the Philippines, but as an example, when you enter their borders, they'll test you, and they will get your genome sequencing, or your genome sequence. So we sometimes see what subvariants are circulating here by looking at what they're seeing in Japan.
Okay, Professor Guido David, always a pleasure. Maraming salamat po.
Thank you, sir.
Thank you,
Yan po.
Prof.
Thank you, the Chiefs, and Happy New Year.
Professor David of Octa Research. And we will start up another conversation after this break. Keep it here on One News.
Let me explain why Fukushima is important. Kasi yan ang tinatanong. Mangyayari ba yung Fukushima sa Pilipinas? Now, why will that not happen in the Philippines? Number one, the elevation of BNPP is 18 meters higher than the tsunami. Number two, we have never had a magnitude 9 earthquake. Number three, all the 450 nuclear plants in the world did a root cause analysis. Because we know what happened in Fukushima, to make sure that ang tawag po ng LOCA, loss of cooling accident, does not happen.
Bakit ang Japan ang taas ng gamit ng nuclear? They have the most expensive power in Asia.
The price for nuclear power, there's a huge difference between the Western ones, like the ones in the US and the UK. They have suffered a lot of delays. That's what makes it very expensive. Umabot ng $10 to $12 billion. But in the past 5 years, there are two countries that have produced nuclear power plants at cost.
Power rates may go up this year due to suspension of a crucial supply agreement. Worse, it may lead to a power crisis. But President Bongbong Marcos is eyeing the revival of the Bataan nuclear power plant, his father's billion-dollar project, which was never put to use. Will this really solve the country's power woes? We talked to Dr. Carlo Arcilla, Director of the Philippine Nuclear Research Institute. Sir, magandang gabi and welcome back to the Chiefs.
Good evening, sir.
Good evening, sir.
Good evening, sir. Good to have you again. Sir, can you hear us?
Yan na.
Sir, can you hear us? Okay.
Okay.
Okay, yes, sir.
I heard something about revival of the BNPP. First, if it's the BNPP, that's the purview of the Department of Energy.
Yes, sir.
Kasi nuclear power yan, ano?
Yes, sir.
What I can just
Don't worry.
agree with-
No, we just want to know about the policy, what policy direction we're looking at. Anyway, sir, talk to us about the nuclear energy plan. Where are we exactly on this right now?
Okay. Yeah, it's like this. The plan is still being constructed. The Nuclear Energy Program Interagency Committee has already started to meet, and there is actually a plan to make the timeline, and then the National Power Corporation, I think, will be in charge of that. So what will happen? Because as you say, and I think also from my sources, that we will have a serious energy crisis. But the energy crisis that will happen now in the next 2 or 3 years cannot be solved by nuclear, simply because the earliest that we can have the nuclear in the Philippines is to rehabilitate the BNPP, which is about 4 or 5 years. That is what the timeline, if the Koreans is accepted by the government.
Okay.
The small modular reactors will be 8 years. So, wala talaga, it will not happen
bitin
in
pa
the
rin.
next year. Yan po, that's the most important consideration here. So, importante yung ginagawa ng DOE ngayon, very important is to actually find a replacement or a backup for Malampaya. That's why it's important to actually drill new wells, and I'm very happy with the DOE. They have aggressive programs. And I think nakipag-deal din si President natin doon sa China na huwag na tayong bulumugin doon. Sa atin naman yan eh, di ba? So, kailangan po, we need that power, because 50% of energy comes from coal and 90% of that is comes from Indonesia. And then if Malampaya is 20% running out, so we have a serious issue. Geothermal, we are actually very good with renewables kasi we're number 2 in the world for geothermal. Provides 13%, 15% of our power. But the geothermal areas have been maxed out. Maybe they can improve the efficiency. So we have very little choice, We have to increase the renewables, most definitely. We can ramp up the solar and wind. But the issue with solar and wind is they're only available 30% of the time.
Yeah.
So you need a backup for 70%, and that now is coal. So nuclear can back up. So maybe within if the renewables buys us time, nuclear can come in to back up the renewables. Because nuclear is really cheaper to run, than what we have right now in existence.
Yes, sir. Sir, the last time we talked to you...
You know that the biggest misgiving against nuclear energy is still the safety factor. And in fact, I just came from some party the other day, and we were talking about the January 1 technical glitch in NAIA. And someone actually said, kung yun lang nga, nagkakamali or nakakaligtaan at hindi masolusyonan, hindi malaman kung ano talaga yung mali ron, di lalo na kung nuclear power plant. What are your thoughts on comments like this? No? Talagang there's no trust that the government will be able to run efficiently many of these major undertakings, and a nuclear power plant at that, very dangerous.
Okay, thank you very much for that comment. I mean, it's important that it's discussed, no? Kasi, in fact, some people tell me, hindi nyo mapaandar yung trend bago pa ng airplane, mag-ambition ka ng nuclear power plant, okay? My answer to that is this. The technology of a nuclear power plant is actually simpler than an airplane. It's 60 years old, no? And who maintains our airplanes? Our Filipino engineers, And so, the important thing for safety, kasi the number one running a nuclear power plant is that it has to have a license. And the license has to be given by a regulatory body. The basis is safety. That's a number one consideration. Okay? So, ang unang tatanungin dyan, what are your backup systems? then they will check to actually if it works. Wala kasi ng regulatory doon sa, like sa airports eh. But in a nuclear plant, required sila to actually, there will be inspections. Our nuclear plant, before it runs, will be inspected by the International Atomic Energy Agency. By the way, the head of that is visiting the Philippines end of the month. You might want to interview him kasi, he is the head of the nuclear watchdog, what's happening in Ukraine. Ngayon, may gera pa nga doon. Imagine doon sa Ukraine, nuclear power plant, So, one important thing if we really want to go nuclear is to have an independent regulatory body. Nasa Congress na po yung batas na yan. No? Kasi ngayon, we are the regulators at PNRI but we're not independent. I report to the Science Secretary. If that regulatory body is done, the regulators will be independent reporting to the President. So kung may problema sa nuclear plant, kasi nagre-report sila, pwedeng sabihin diretso, umayos ka kaagad. Kasi there's no such regulation like that for coal plants, for gas plants. Sa nuclear kailangan talaga. No? Praning talaga. Praning is the nice adjective for nuclear power. Tama po kayo dyan. No? I have just visited the nuclear power plants in Japan and with DOE people. There are 450 nuclear power plants operating in the world right now. 450, providing 10% of its electricity, of the world's electricity. The newest plants built in the UAE, apat yan na oil-rich countries. Many Filipinos were involved in the construction of that.
Which brings up, actually, nabanggit nyo itong mga Filipinos involved in nuclear programs abroad. Nabanggit nyo rin po kanina ang Filipino engineers. What's the national human resource requirement for us to run responsibly and sustainably a nuclear plant here at home? And where are we in that requirement?
Okay, thank you for that question. Right now, we don't have the engineers because there's nothing to work. In the 1980s, we sent about 80 engineers abroad. That's in the bright test to train. Then, a few months before they were about to operate the nuclear plant, suddenly, it was canceled. So those guys remain mostly in America. Those guys are retiring now. In fact, I just had one visitor in my office. I'm retiring. Use me if you want to start a nuclear program. But realistically, where will we get it? For example, there's a Korean offer apparently. If the Koreans make an offer to restart the nuclear plant, they have an exact model in Korea running now. What that means is that we can send our engineers to train there, okay, for that operation. You need about 600 people to run a nuclear power plant. Isa lang ang nuclear engineer. Ang kailangan din yung operators. Okay? The operators can be trained. And they have to pass examination. Kaya nga importante yung regulator talaga po dito. So, now, the regulators, we need some help with that kasi we haven't had experience running. Actually, we have a nuclear facility now, by the way. Right now, I am less than 100 meters from a research reactor. Here, alam niyo po yung Itlog?
Yes.
We just restarted that in July. That has nuclear fuel. The fuel in this reactor is 10 times richer than a nuclear power plant, pero lesser ang amount. That's why we have strict security here. So we already know how to run a nuclear facility. We've known that for 50, 60 years. We have a facility here. And maybe one of these days you can visit it so that to see. It's really not a big deal.
Director, ang pagkakaiba niyan, it doesn't supply energy to households. Yung facility niyo na yan. So may pagkakaiba yon. At tatanong ko lang saan natin kukunin yung regulator. Dahil sabi niya, it needs strict regulation. Kung we don't have the expertise, saan natin kukunin yung di naman tayo pwede imported talent sa...
No, ma'am, may regulators na tayo ngayon. By the way, for example, the radiopharmaceuticals that come here to treat cancer, we regulate them. For example, we have strict regulations. We regulate hospitals. I signed the licenses for cyclotrons. So even if walang nuclear program, mayroon talagang regulators tayo. We inspect hospitals. First, alam niyo po yung mga pumunta kayo sa yung may badge. Those are under regulation. Kung hindi na-expose yung mga tao. So we are very active. In fact, a big part of our income comes from that. And our regulators are trained in many places in Vienna. So, we have magdadagdag po tayo ng regulators for nuclear power plant.
Siguro, Director, mababawasan yung resistance to nuclear energy. If you can explain na merong mga ganitong peaceful uses, actually, na ginagamit na natin ngayon. So maybe you can tell us more about it. Apart from treatment, yung sa medicine, saan po siya ginagamit ngayon, ha? Ngayon na.
Okay, bigyan example na lang. Nuclear medicine, okay? 70,000 people, Filipinos die of cancer every year. And the best way to detect cancer, the gold standard, is through PET CT scans. So give me a chance, Professor din ako, in 2 minutes explain ko kung bakit importante ito. Okay? Kasi cancer cells are rogue cells. They consume a lot of sugar, so they starve the surroundings. So sabi ng scientists, how can we use this characteristic to be able to detect the cancer cells? Yung sugar po kasi, it's a carbohydrate, mahabang molecule yan. So using electron beam at saka nuclear technology, in-slice po yan into small fragments. Nakakasya. Sorry. They will. I apologize. Let me say it again. Using a cyclotron, you accelerate protons to hit the oxygen of the sugar, and then it comes fluorine. So radioactive fluorine which shoots harmless positrons. So yung compound mo ngayon, FDG, pareho pa rin ang sugar characteristics pero may pumipitik ng positrons. If you inject that to a patient, kung may cancer po yung patient, it will enrich itself with the FDG. Dahil pumipitik na yung positrons, kung meron kang positron emission tomography plus CT scan, you can actually detect where the cancer is, how big. That's being done right now. The problem is, ang mahal, 120,000 ang original yung isang hospital nagpatayo yan, tapos ngayon 60,000. Kaya pag pulubi ka, parang hindi gagawin sa iyo yan. Ngayon, may project kami dito to lower that cost to about 20,000. That is nuclear working for you. One example. Pag-treat po ng mga lahat ng cancers, yung tawag sa thyroid, mga imaging po.
Radiation.
In fact, MRI is nuclear technology. Ang pangalan po ng MRI dati is nuclear magnetic resonance. Nuclear kasi ang sama daw ng effect. It's unbelievable, you know. It's nuclear technology. So, and then, isa pa po, yan, explain ko rin ha. Ito, thank you for giving me this chance. Meron tayo ng crisis arise. Alam niyo po ba, naka-invent kami dito sa PNRI. Yun nga, explain ko pa yung carrageenan. It's a long molecule from seaweed. Using electron beam slice into small fragments, kakasiyan doon sa stomata ng leaves. You spray it, the yield in rice is additionally 20%, and it strengthens the stalks. So hindi na pag bumaha, hindi na siya matutumba. Hindi ko lang ma-explain to kay Presidente. It's beyond my salary grade to talk to him.
Kaya niyo yan, Prof. Kaya niyo yan. Do it.
Anyway, sana ipapakita niyo sa kanya. Kasi, tested in thousands of hectares. Lahat ng plantito, kung may leaves, nagwo-work ito. In fact, mag-deliver ako sa inyo kung may mga kayo, may papaya plantation ako eh. Ang ganda talaga ng tanim. Kasi yung leaves para siyang Filipino invention, naka-invent niyan isang scientist sa atin, si Dr. Lucy Sabata.
Well,
So, dalawa pa lang example yan, marami pa. So, kung walang nuclear program, buhay kami dito. We are the most productive institute in the whole DOST. DOST has 18 agencies. Last year, 120 papers ang pinablis, kalahati galing sa amin.
Okay. Now, Doc, I mean, to Ami's point, ayun nga, magandang malaman din ng mga kababayan natin that there are applications already for nuclear science here. It's reassuring. It also helps for people to appreciate the technology. But let's go back to issues pa rin ng mga tao sa safety. You talked about the plants. Now, regardless of which technology or which provider or contractor we do, regardless of the model, whether it's the BNPP, the Korean technology, the modular plants, how do we handle nuclear waste?
Thank you for asking that question because that happens to be my expertise. Kasi I'm a geologist. I've done before I got hired here at PNRI, I was director of National Geological Science at UP. And one of my researches is this, kasi ang program ko sa nuclear waste ito, it will last for 10,000 years. So, human civilization is only 100 years. So, paano mo siya? So, you take it away from the contact with human civilization? How do you do that deep geological burial plus engineered barriers? Okay? Ano, okay. Saan natin, for example, sabihin natin, in-approve ni Presidente BBM yung nuclear program. Okay? Siyempre, kung tatanungin po ako, sasabihin ko sa kanya, Mr. President, we have to deal with the nuclear waste at the beginning because the big mistake of the other nuclear programs in other countries is that they delayed the disposition of the nuclear waste towards the end. What is my proposal for this? Okay, number one, we have the geothermal technology. We drill 3-kilometer deep wells. Okay, so my proposal is if we have nuclear waste, you drill an isolated island, very deep well, pwede mong i-bend yan like Beckham, horizontal, and then you plug it with bentonite. Why is bentonite important? Bentonite kasi is a clay mineral, negative layer yung kanyang crystal structure. So pag na-escape si uranium positive siya, trap siya doon. That is the design of all the, yung bentonite buffer is the design of all the nuclear waste disposal. One is being constructed now in Finland. Now, tayo, we have the technology, pero wala naman tayong spent fuel. Marami tayong isla. Sinadjust ko lang isa, pero na-allergic yata yung iba. Kasi sabi ko, ilagay sa Pag-asa para huwag nang i-claim ng bansa dyan sa Northwest, no? Yung islang yan, no? But anyway, what I'm saying is that we can dispose of nuclear waste very safely, and we can even demonstrate it. In fact, again, para makonvince yung mga tao, mag-drill tayo, demonstration well, para makita kung tutulo ba yan o hindi. Titira pa ako sa islang yan. Kasi kung sa islang yan, mag-charge sila for the waste, yayaman yung mga tao dyan for rentals.
Doc,
Ano pag
ano po?
nag-earthquake? Ano pag nag-earthquake?
Okay.
Nasira yung...
Na magnitude 9 ha.
Baka kung mag-glitch. Paano kung mag-glitch over time?
Hindi, yun yan. Isa-isayin natin. Earthquake, ma'am. Earthquakes are strong in the surface waves. At 3 kilometers depth, hindi mo nararamdaman yung earthquakes. What's the demonstration proof of this? Nung 1990 earthquake po sa Baguio, nasira yung Baguio, ano? Yung nandun sa building sa surface, nasira. Yung nasa underground, walang nangyari. Silang nag-rescue dun sa surface. So, earthquakes are not a problem. Yung leak is taken care of by the bentonite. Okay?
Ano yun?
So, because bentonite is
Plug nga raw ng
plug
penton.
talaga yan. Plug talaga yan. Walang makakalusot dyan. In fact, ginagamit din yung bentonite sa mga landfills para hindi siya magpunta sa groundwater. Pero ito, very specific for uranium, it's able to absorb it. No? So, anyway, ask more. The more difficult, the better.
Ako as a consumer, how much will electricity rates go down if we go nuclear? Ultimately, that's really what we're trying to solve, right? The energy
Ganito po,
problem.
Very good. 79% of the Filipinos favor nuclear in a survey by DOE last 2019 because of high electricity prices. 79%. South Korea's electricity rates, they have 24 nuclear plants supplying about a quarter. 50% yung kanilang 50% yung kanilang electricity rate. Ang taas pa lang ng GDP. Sa atin, parusa talaga kasi ang mahal nga ng kuryente, di ba? The median Filipino family pays more than 10% of the take-home pay for electricity. If you do that metric in other countries, that's less than 1%. I had a Chinese visitor, tinanong ko siya, how much do you pay, for your electricity bill as a percent of your take-home pay? Less than 1%, 0.5. And I asked him, what kind of appliances do you have? I have 4 large air conditioners in my house. So, parusa talaga. If we had a lot more geothermal, you should not even talk about nuclear, pero we have very little choices.
Tanungin ko ulit, bakit ang Japan ang mahal-mahal?
Bakit?
Japan uses nuclear power extensively and they have the highest power cost in Asia. Bakit ganon? I will ask that question again.
Lahat naman mahal sa Japan eh.
Yes, ma'am, no. Maganda pong point, ma'am. Ganito. Actually, to answer your question, ganito, after Fukushima, they closed all the 55 nuclear power plants supplying roughly about a quarter of their power. So, because of Fukushima, they closed it down. Boom. Ano nangyari sa kanilang price? Nag-shoot up kasi ang kapalit ng nuclear ay imported liquid natural gas. Yan ang plano ng ibang power producers dito.
No, mataas na ang power cost nila during even before Fukushima. They have the highest.
Because
Even before Fukushima.
but that's because of that's something unique to Japan, But if you look at, for example, the U.S. I lived in the U.S. for 11 years. Ang mura talaga, my electric bill was less than afterthought.
That's true.
In the U.S., 20% ng electricity nilagaan sa nuclear. Hindi lang anak. Kaya nga sabi nila, takot sa nuclear. Galing ka na ba sa Amerika? Hindi mo alam na 20% ng power mo doon galing sa nuclear power.
Eh, sariling lang isang US, they can generate their own.
Ano po?
They have their own, they have their own.
Pero nuclear din sila, Ami.
Nuclear, pero hindi siya ganun kalaking Hindi ganun kalaking component.
Now in the US, it's 20%. They have 100 nuclear power plants, 92 yata ngayon, operating for 60 years. And they're giving them another license for 20 years. And then we're not even talking about carbon, the cleanest energy source by far. Walang emission is nuclear.
Doc, we get what you mean when you say na wala namang question doon sa skill ng Filipino in terms of running, for example, a nuclear power plant. We're really good at a lot of things. Pero I suppose yung concerns would be as far as yung public or government management of for example, utilities. Just as an example, yung nangyari nung January 1, it was a simple case of a UPS going down. Traced to a blower in a UPS, yung uninterruptible power supply. It's not even the air traffic management system.
Breaker daw
Diba?
din. Sabi sa hearing.
Yeah. If I may, I'll connect this to Fukushima, di ba? Fukushima, if I remember right, ang problema nila, because of the tsunami, nag-down yung kanilang diesel generators, so walang power na nabigay doon sa power plant. Yes, it's grossly oversimplifying it, pero in the same way, what if for some reason mag-down yung power din? For some simple reason, mag-down yung power ng nuclear power plant. So baka it's not a question of skill din, it's a question of public management or a question of how government manages things.
Yeah, okay, thank you again for the questions. That again redounds to regulation, okay? Dapat talaga yung regulator mo. Kasi kung may regulator ka, check-checkin yan. Okay, doon sa nuclear power plants, ang one lesson from the 450 nuclear plants in the world after Fukushima, the Fukushima stress test, how can we prevent that? Kasi sa Fukushima, ma'am, hindi nasira yung nuclear plant nila with the magnitude 9 earthquake. And yung plant nila is even older than our BNPP. Okay? Ang problema nga doon, natawag ng LOCA, loss of cooling accident, loss of cooling accident. So ang ginawa nila, dapat daw kasi ang pang-cool off nung mainit na reactor is anong tawag yan, are diesel engines. Nilagay noon sa Japan, nandoon sa basement, so na-flood ng tsunami. Hindi mangyayari yan sa BNPP kasi yung diesel engines, elevation ng planta natin, mas mataas dun sa tsunami height. At saka dadagdagan mo pa ng extra additional, for example, doon sa Slovenia, exact model din sa atin, ang ginawa nila, they created another control room outside the plant. Na pwede mong ma-manage yung plant outside the physical plant itself, Sa Slovenia yun, exact model po ng ating BNPP. So, yun po. And by the way, the country that's building the most number of nuclear plants, yes, is China. They're building 17. They will overtake Japan soon, and they have the most advanced research on nuclear power. Actually, meron na sila yung tinatawag na high temperature gas reactor. It's already there in Tsinghua University, and it's supplying. Na perfect na nila yung supply chain para yung mga kotse. Kaya nakapagawa sila sa Pakistan ng 2 nuclear plants at $3 billion a piece or something like that. So. But I understand, yun po yung concern. Yun nga, nakakatawin nga, simpleng power supply, nagkamali ka pa. How do you protect against stupidity? Di ba? Yan yung ano yan eh. So, and that is done by regulation. By regulation. Kasi wala naman nag-i-screen. Walang nag-i-screen sa mga operators ng airports. May exam sila. Pag nuclear power plant, naku, stringent yung examinations dyan eh. At saka, pag nakapasok ka sa nuclear plant, pag may, hindi nag-iisip na yung mga tao doon, meron na yan. Pag ganitong nangyari, may na siya, may manual, itong gagawin mo. Very little discretion is given to the operators.
Okay. Dr. Arcilla, sir, maraming salamat po.
Thank you, sir.
Thank you.
Thank you, sir.
Invite niyo po si Grossi, yung head ng IAEA. It's a very good speaker.
Tapa, we're taking note of that. Maraming salamat
Noted
po.
po, sir. Thank you.
Director Carlo Arcilla, Director of the Philippine Nuclear Research Institute. And that is all we have for the Chiefs. We hope it was discussed. We'll keep the conversation going. I'm Robbie Alampay.
I'm Ami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Ed Lingao. We are One News, all sides, all the time.